everyone, and welcome to Fletcher Farms Amarillo. I'm Julie Fletcher. I hope everyone had a wonderful holiday season, a Merry Christmas, and a very Happy New Year. It's been crazy busy around here, and that's what this video is about. So the month of December, we have been rescuing more horses and donkeys. So that's what this video is actually about.
All the rescues that we did in December. We didn't rescue everyone all at once, we rescued them in stages. Since the beginning of December, we've rescued 6 Belgian Draft horses, a Percheron, and 5 donkeys.
Been very busy around here, and this is a story about what's happened here on the farm since the beginning of December. So like I said, we rescued these horses in groups. The first set that we rescued 3 donkeys and 2 Belgian Draft horse mares, and this was their story.
Belgian mare right here will be lot 981. I like her. She stands 17.3. That one right there hasn't been used up by the Amish.
Big Mama here is lot 979. Now my phone camera light came on, so if her eyes look funky, that's what it is. They're not messed up. This is lot 978. Now we were told that she is bred. It's not confirmed by a vet, but she does have a good little belly on her. She stands around 11.2, 11.3. This sweet girl is lot 997. She is a little Jenny. You see her little ear has been froze off or broke off or something. Her little legs, she got knots on her knees. Hi, sugar. A while ago the way she stands, she looked a little.
Be like 905. We got Belgian mare right here. Should just be 14 to 15 years old, stands 17.1.
A few days later, we went and picked up the donkeys and the 2 mares that we rescued, and this was from us picking them up and bringing them home to the farm. The donkeys were ready to go, however, the 2 mares did not want to come in from the pasture, so it took a little bit of time to get them up here, to get them loaded into the trailer. But eventually, we got them up here, and we got them loaded into the trailer for their freedom ride home.
Yay! Yay! We got 1. Come on. 2. Moment of truth. Come on, Eeyore. Okay, babe.
There you go. Good job, guys. Come on. Come on, guys. Come on. Come on. There you go, donks. We get a little bit of hay. Yeah. Are you hungry, girls? Yeah, what are you doing, little girl? How are you girls doing? Yeah. We're settling in for tonight, getting some hay and alfalfa. We're all doing good so far. I know, baby. Dr. Hardy's coming out to do acupuncture tomorrow, and she's also going to check up on the donkeys and give them a good checkup. Yeah. Give you guys a good checkup. Yeah, Dr. Hardy's coming tomorrow. Yeah. I know, sweetie. Yeah, you're good girls.
So the following day, Dr. Hardy did come out to give the donkeys a checkup. and she was also at the farm to give Fiona acupuncture. Dr. Hardy did an x-ray on little Eeyore's legs to make sure that she didn't have any broken bones or anything like that.
So I don't necessarily think this is, maybe an old fracture here, but I think it's more just how she was designed, and all of this bumpiness is arthritis building up.
Okay.
So, changes that, I think has been lifelong.
Is this swelling?
Yes, that soft tissue swelling is that light stuff there.
Okay.
And then you can see on this view, much, it's a little fuzzy here, but you can see all that's swelling right there. So she should have much better joint space in between all those, and she just doesn't.
Gotcha.
It's just not there. So,
How old do you think maybe she is? Like older?
Yeah.
Okay.
Looking at that for sure.
Dr. Hardy gave everyone an exam and also did blood work on all 3 of the donkeys. She also did a pregnancy test on this donkey because they said that she was running with a little jack. So we'll have the results on their blood work in a couple days.
So Dr. Hardy was out to give everyone a checkup today. This is the one donkey. She had kind of a snotty nose. Dr. Hardy gave her an Exceed shot, which is a long-lasting antibiotic. So she got a shot. And the little donkey with the broken ear, she has arthritis in those front legs is what that is. And we asked Dr. Hardy if there was anything to do for her ear, if it's possibly broken, and she said that they don't have any bones in their ears, so it's all cartilage. There isn't really anything you can do for them. So it's just going to be the way she is. But she did do a pregnancy check on her because they said from the stockyard that she was possibly bred. So we did do a pregnancy check on her.
And we should have those results soon.
So Dr. Hardy called this afternoon, and all 3 donkeys' blood work is perfect. It's dinner time here, so the natives are restless over there. I don't know if you can see them running behind. Hi, little girl. Oh, come here. Come on, sweetie. Hi, little girl. How are you? What are you doing, sweetie? I know your blood work's all good.
So the little girl on the left, we decided to name her Pudge, and the little donkey on the right, we decided to name her Gretchen. Gretchen did get over her snotty nose, and Dr. Hardy did call back eventually and let us know the result of her pregnancy test. And she is pregnant, so we will be having another little baby donkey probably sometime in August. So the 2 mares were settling in very well. The horse on the right, we decided to name her Angel, and the horse on the left, we decided to name her Riley.
Hey everybody, we have the donkey with the broken ears. We've decided to name her Eeyore. We have her in the trailer today because we are taking her down to MVP because she is having some coughing and some nasal discharge, and she's not eating very well. So Dr. Wagner is going to check her teeth and give her a good checkup. Her blood work that Dr. Hardy did the other day was fine, but she does have some discharge coming from her eyes as well, and we want to get that checked out too. So we are taking her to the vet today to get a checkup, and hopefully she's going to be okay and we can get her back healthy and back to a point where she's eating, because she's really not eating and drinking very much. We had little Eeyore to the vet today, and Dr. Wagner redid her blood work because she wanted to see if anything had changed since Dr. Hardy had pulled it the other day. Her SAA levels, meaning that she has an infection, that was definitely very elevated, and she also, her liver enzymes were also elevated, and she was definitely dehydrated because she really hasn't been eating or drinking. So Dr. Wagner's recommendation was for her to stay at the vet's office on an IV, and hopefully we can get her feeling a little bit better. So she's going to stay at the vet's office, and she's going to be monitored, and hopefully we can get hers to start eating. And Dr. Wagner was going to take a closer look in her mouth tomorrow, but we just wanted to try to make her feel a little bit better and get her hydrated, and hopefully she would start eating again. So we will keep you posted, but little Eeyore is staying at the vet for a couple days.
We did find out that Eeyore was colicking and that she had some type of impaction. Eeyore did pass away at the vet's office just a few days after she was there. So unfortunately, we weren't able to give Eeyore the life that we wanted to give her, and she will definitely be missed. But in her last days, she knew nothing but love and kindness. We did everything that we could for Eeyore, and we just wish that we could have given her so much more time here on the farm to be part of the herd. We got Riley and Angel to the vet so they could get their blood work done, their teeth done, and just get a regular checkup before they were going to get turned out with the rest of the herd. Riley and Angel both got their teeth floated. Their teeth were in pretty good condition, however, they hadn't been taken care of in quite some time. So Dr. Wagner got these sharp points taken off their teeth so they would be a little bit more comfortable while they were eating. Angel wasn't quite walking right, and Dr. Wagner suspected that she was having an issue with her stifle joint on her back left leg. So we did go ahead and do some x-rays on her leg, and she does have some stifle joint arthritis.
To back through the joint, and all of this is really abnormal. So lots of arthritis, decreased joint space, and then you can see some of that change there too. But there's also like some fragments in the joint space. So what I learned from talking with the surgeon about the little filly is that like they can't get to all this. So like even a surgery wouldn't, the right looks really good. Even a surgery, like you could maybe get these out, but I don't think that's necessarily, most of the problem is going to be back here. And all of the, this is arthritis, but it also ties into the collateral ligament of that joint. Like,
as with all of our other horses that have arthritis, we did get her a steroid injection into her stifle joint, along with something called Noltrex, which provides a little bit more cushion. We also did an Osphos injection, and this is another treatment for arthritis in horses. So with everybody else that has arthritis in our herd, these two options have really helped them come along and live a comfortable life.
And then the second set of horses that we rescued was again from Wish Upon a Horse. They are a kill pen here in McLean, Texas, and they have another group that comes in and tries to help adopt out some of the horses that they get into their kill pen. So some of the horses that we've been rescuing lately are from Wish Upon a Horse, and they're only about an hour away from us in McLean, Texas. So hi, bud. So we've been rescuing horses from there as well. So the second set also came from Wish Upon a Horse, and we rescued a gelding, a Belgian gelding, a Belgian mare, and a Percheron mare, and this was their story.
This is lot 878, 16-year-old Percheron mare, staying 17.3. This is lot 950. An 18 to 19-year-old Belgian mare. She's staying 16.2. Looks clean all the way around. This baby is lot 504, a smooth mouth gelding. You can see there's lots of gear marks up there on him.
Since these horses were just in McLean, Texas, the owner was coming into town with some other horses and dropped them off for us. So a few days later, these 3 horses arrived at our farm. This was the gelding. I didn't get a video of the other 2 coming off the trailer, but this was the gelding, and he's just a super sweet old little guy.
Hi, sweetie.
The Percheron mare was having some issues. As soon as she got here, she laid down. She couldn't breathe and she was coughing. She also had nasal discharge from both nostrils, so we ended up rushing her down to MVP the same day that she got here, probably about an hour after she arrived to the farm. This video is when we got to MVP. This is Dr. Wagner giving her an exam and checking her out to find out what was going on with this poor girl, who we decided to name Myrtle. This is Dr. Wagner doing an ultrasound of Myrtle's lungs.
So this is the end of her lung field right in here. And you can see her heart beating over here. She's got some abnormalities in the end of that lung field where it dips off right here. That's some consolidated lung. And see then her heart. So kind of like some abnormal lung surface there. And then her heart's beating right there.
What does that usually mean?
Well, the heart's normal. That's
Okay. But the abnormalities of the lung?
Right. So she does have pneumonia.
Okay.
It has not progressed to pleural pneumonia, which is sometimes worse, where they get like a large volume of fluid accumulation in their lung.
Okay.
She has, let me get this. to show up. That's a really cool image. Okay, so the picture's just not great. She's not imaging super good, but this is totally like consolidated lung that's not filled with air anymore because of the disease process. So there's like mucus blocking it, bacteria, exudate. So she's definitely got abnormal lung, especially like at the margin. So like up in here, it's decently normal on the surface at least. Down here at the edge of it on the surface, it gets really abnormal. We can't really visualize the internal part of the lung because any lung that has air in it blocks us from seeing deeper. So we can't say that there's not more abnormal lung like on the inside. So things I don't like are her respiratory effort and high respiratory rate. You know, I think she's pretty uncomfortable. I think she's really sick. These would be like cases in humans where they'd put them with some like oxygen supplementation. You know, one of those cannula things. But we don't really have that ability. This lung right here that's not aerated. We don't have that ability in horses, so we end up just trying to use medicine to try to help them. So she's going to get started on really whopping doses of antibiotics. Right?
Are you going to keep her?
Yeah. The other thing that can be beneficial in this case, she's not, I'll go over the blood work with you in a moment. She is not losing white blood cells yet. Like, you know, as far as when they have a really bad infection, their white blood cells go to that area to try to fight it, and so they end up having low white blood cells that we measure in their blood. Because all the white blood cells are in the area. So she has just a low normal white blood cell count right now. But sometimes one of the things we do for these super sick horses is give hyperimmune plasma. Because it has antibodies to some common pathogens. It helps support the white blood cells. So she's a little like, we don't have to do it tonight, but it might get her started off on the right foot.
Whatever we have to do to make her better.
If her white blood cells were super low, I would say, yeah, we definitely need to do it. She's borderline right now, but it hopefully would help her.
Whatever we have to do.
Her case is going to be one that I consider pretty severe. Just because of her respiratory effort. Like, I know she can't breathe very well, and that's scary. These take like pretty high doses of antibiotics for a while. And so she would stay with us for a while just because I don't want her to.
No, we're good with that for sure. Dr. Wagner did get an IV started, and she did receive the plasma treatment that she talked about. Myrtle also started to receive high doses of antibiotics and has stayed at the vet for probably now about 3 weeks or so, maybe a little bit longer. She is going to be coming home on Monday, January 6th, so we're super excited about that. And this poor girl is finally over her pneumonia, and she also had influenza. So this poor girl went through so much while she was at the vet's office, but she's definitely recovered now, breathing better, and we're super excited to be bringing her home on Monday. So this is the gelding that we rescued. He's settling in well, and we decided to name him Duke. And the sweet little mare, I didn't get much video of her because we were dealing with Myrtle's sickness, so I wasn't able to get a lot of video of her, but she is doing well too, and we decided to name her Gemma.
And we have the new gelding and the new mare. He's super sweet. Yes, you are.
We did get Duke and Gemma to the vet for their checkups so they could get blood work checked to make sure that they were healthy, their teeth floated, and just a regular exam to make sure that they were good and they weren't having any other health issues. Overall, these two were pretty healthy. They got their teeth floated. Duke got his sheath cleaned, and They also got their vaccines and just a regular checkup. Everyone seems to be in really good health, and when we got home, these two went out to join the rest of the herd. And as you can see from this video, the barn expansion is just about complete. They're finishing up a little bit of the work and everything will be done with our barn expansion.
Good job, guys. And the third rescue in our December group was a mama donkey that had a baby at Bowie, Texas Livestock. They posted her on the website a day after she was born, and this was her story.
Number 4161 and 4162 with the Bowie, Texas Livestock. This is going to be little Jenny Standard Donkey. She's 5 years old. She had that cute little baby that's on her side this morning. So anyone willing to help that pair out, that baby's going to be a little Jenny. She's 1 day old. And that mom is trying to do good taking care of that baby. Little bitty little thing.
The next day we rushed down to Bowie, Texas Livestock to pick these two up. It was very important to get the mom and the baby out of the livestock yard as they needed to have some medical attention and make sure that the baby was nursing and watched 24/7.
There you go, Tony. There she goes.
Watch out, little one. There you go.
I think, yeah, I'll take that for Christmas. All right. Thank you.
Nugget, you little nugget.
While we were picking up the donkey in the very back lot, I saw this skinny Belgian, and I was told that he was on the direct ship list and he was going to be shipping to slaughter that day. There was no way I was going to let that happen, and I asked David if he would let me buy him, and David of course said yes. And so that's why we had an extra traveler coming home with the mama donkey and the baby. This was the new gelding getting his halter put on so we could get him loaded onto the trailer to come home to the farm for a fabulous life of retirement.
Come on, pal. Let's go. We're going home. We just stopped for fuel, and Mama and the little baby are doing good. She's protecting her, and she's safe. We have a gate in the middle, separating this guy who's super skinny. Yeah, you're okay, pal. We're going home. Yep, we're going home. She's doing good. I know, little chicken nugget. I know. Gotta hold on just for a little while longer. We'll get you home. What you doing, little girl? Are you okay, little girl? I know. We're going home. You're gonna be safe. I promise. I promise you're gonna be safe. I know, just gotta get a little further. Come on, pal.
Oh, he's got bad setback because of the sword.
I know, we'll get him fixed. You're okay, Mama. It's just the cutest little thing I have ever seen. Yeah. Hi, mamas. You're okay. Oh, look at you. You're so precious. Yes, you're precious. Good mamas. Yeah, you're a good mama. You okay, sir? You tired? I know, buddy. It's okay. Are you okay?
This guy was extremely tired after traveling yesterday, so he was pretty slow to be walking. We did get the farrier out here, but I did not get a video of that, and his feet are definitely taken care of because his front feet were super long. But we did decide to name this guy Jonah, and he's been doing well. He did have a little bit of diarrhea, probably from the diet change and onto being on a good feed. So he's been eating alfalfa and beardless wheat, and he's been doing really well on that. So we'll be getting them to the vet sometime next week now that the holidays are over. So he's doing good so far and relaxing, and we're excited to be able to get him out with the rest of the herd after he gets checked by the vet.
What's doing, sir? The good stuff? Yeah, that's good stuff. Are you getting bronchi? Yeah. What are you doing? Oh, we're talking? Were you trying to talk? Hi. Hi. I know you're a good girl. I know.
We did take Mama Donkey and the baby to the vet as soon as possible because Mama had a lot of swelling on her backside, and Mama is pretty much feral. She won't let us touch her. So we ended up taking her to Claude Veterinary Hospital because they have this stock that we can put her in and a chute that we can run her through. So this was a lot safer for her, and mobile veterinary practice just doesn't have these accommodations for a donkey. But we did get her checked out, and she does have a lot of swelling, so she got medication, some pain medication, and an antibiotic shot, and we're keeping an eye on her because she still has some swelling back there. We also did blood work while we were there for Mama Donkey to make sure that her liver and kidneys and everything was functioning properly. She did have a little bit of an infection, like I said, and they did give her an Exceed shot, which is a long-lasting antibiotic shot. They also checked out the baby donkey while we were there. They cleaned her umbilical cord site. Doesn't look like she has an infection, and she's been doing well. Mama does have milk in her sac, so that's a very good thing. So Mama and baby got a clean bill of health, and we're just keeping an eye on them to make sure that we don't have any other issues with them. Since the baby donkey was born on December 20th, our intern, Taryn, her grandmother's birthday is on December 20th. So we decided to name the little baby donkey after Taryn's grandma. So her name is Renita, and then the mama donkey, her name is Katie, because Katie is one of the vet techs at Claude Veterinary Hospital, and her birthday is also on the 20th. A local news channel found out about our rescue just a couple days before Christmas, and they wanted to do a story on the mama and the baby donkey to air on Christmas Day. This is Canyon from News Channel 10. She came out and interviewed us and did a story on the baby donkey and the mama and also the other Belgian horse that we rescued. So I'll put a link in the description below with what was aired on the news along with the story. We're super excited and thankful that they came out and did a story on our farm.
And then the fourth rescue we just did on New Year's Eve. We did a New Year's Eve fundraiser to rescue a Belgian gelding that was at Bowie, Texas Livestock. And this was the story of him.
4177 with the Bowie, Texas Livestock. You talk about a big Belgian gelding right here. 18 freight, and he is just 5 years old. And you talk about a gentle giant right here. Very, very quiet, very laid back and gentle. He is primarily, it seems to be separating a little bit just here. But I think as that grows down, keep him shot up. Also has a blue colored eye, a little bit unusual on these Belgian horses, but he has blue color to the eye, nothing wrong with it.
We ended up doing a New Year's Eve fundraiser for this guy, and we were able to raise the funds that we needed. So this was us at Bowie picking him up. And while we were there, he was out in a pasture, and this little 3-year-old filly came running up with him. I saw this little filly posted on Bowie, Texas Livestock's website. However, I made Corey a promise that we were only going to rescue one horse on this trip and I wouldn't be bringing any other horses home. However, I did see this filly posted on their website the day before. So since she ran up to the barn with the big guy that we were rescuing, I wanted to take a look at her as well and see if she was going to be another horse that we were going to rescue.
He is a big boy.
Is that the other horse we were looking at too?
Yeah, I think that's that filly.
Number 4175 of the Bowie, Texas Livestock, Belgian filly. Coming 3 years old, 15 hands. Nice filly right there. She is young. She is pretty. She's pretty darn well put together. She is halter broke. She's going to be a little off to the first right.
So as usual, we ended up having an extra traveler and we brought this sweet little girl home with the gelding as well. From the way she was running up to the barn, it does look like she has something wrong with her front right leg. So we will be getting these two to the vet as soon as we can.
Step. Come on.
Yeah.
Come on. Good girl. I know. We're going home. I know, big man. We're going home. Here we go. Hey, big guy. What you doing? We're stopping for fuel. And the little guy and the little girl. Well, the big guy and the little girl are doing good. Yeah, what you think? What you think, big guy? I know, we're almost home. Give her a second to figure it out. Watch out, Mary.
There we go. Look at you.
Hold on, buddy.
Huge. Woo. Big boy.
Big sir, what you doing? Hi. What are you doing? You are a big, big boy. Yes, you are. How are you feeling? How are you doing? You don't know yet? So he isn't limping very much on that foot. We are going to take him obviously to the vet. We haven't made an appointment for him yet because we do need to let him settle in a little bit. Putting him back on the trailer usually stresses him out way too much. So he's been doing good. He's eating and drinking and going to the bathroom. I'm trying to take his tag off, but I don't know if that's going to work out so well. But he is doing good. Bless you. He's made piles of manure, so that's very good too. Yeah, oh, you are a big horse. Yeah. And his eye, I'm really not sure what's going on with his eye. He's definitely visual out of it. I don't know if that's just the pigment in his eye or what, but Dr. Wagner will definitely check that out too. Yeah, you got yuckers. Yeah, yuckers. And we've got little Missy. Are you little miss? Yeah, are you a little miss? Little miss girl? Huh? Oh, you're so sweet, baby. Oh. Can I pet you? She's a little standoffish. She was a little standoffish yesterday. Still kind of today. She does have something wrong with her front right foot. I don't know if you can see that in like her knee area. It looks a little bit swollen, so don't know if it's an injury, an old injury, or what the situation is there, but we're definitely going to get her checked out at the vet. But that's how these two are doing. So that's what's been going on here, and that's been all the rescued horses that we've rescued in December and our first rescue of 2025. So it's been a heck of a year, and we really can't thank you all enough for all of your support. Because of all the horses that we've rescued recently, we are doing a fundraiser still for all of their medical. Since Myrtle was at the vet for so long, she has a very large vet bill right now, so we do still have that fundraiser going. So if you wanted to help support us in any way, that fundraiser is at thebighooffoundation.org. And of course, we always need feed. If you wanted to donate feed to us through HFNC or Mall's Feed and Seed, I'll put the link in the description below where you can do that as well. So 2024 was an amazing year, and we really can't thank you all enough for your support, generosity, and kindness. And I think 2025 is going to be an amazing year as well. So stay tuned for more updates, and thank you all again so much for watching. We truly appreciate your support. Thanks.